Hello, this is Richard Downs from Sleep Balance Academy, and I have on the line with me today. Let me just start over again here. Hi, it's Dr. Richard Downs with Sleep Balance Academy. I have on the line with me Mike Gassman, and he is substituting for Matt Quinn, who's going to speak to you about our recall reactivation program following Dr. Bass's presentation. And Mike is going to talk about the in-hand health program and how we use it in the sleep screening, diagnosis, and referral program that I've been teaching chiropractors, but also in general, how it might benefit chiropractors in reactivation of patients and those patients who need to be on continuous maintenance programs. So thank you for
glad to be here, Dr. Downs.
Yeah.
Good to see you.
So Mike, why don't you tell us a little bit about in-hand health, how long you've been around, and how you could benefit the listeners.
Sure. In-hand health was founded in 2014. We built a powerful platform that would support multiple specialties. It was designed to be able to put the power into the hand of the patients. Our goal was to be create better outcomes at a lower price for patients and to help providers be more effective, efficient, and profitable. So we initially deployed in physical therapy. We did work in home health. We've been in multiple specialties, and most recently we've been in dental and sleep. The platform works well and works across all of them at the same time. The capabilities are pretty much unlimited, but the most important thing is that it provides communication and connectivity between the practices and the patients, so that the communication, whether it be text, video, live calls, and the compliance monitoring, the ability to reach out, notify patients, send them alerts, keep them aware, and tracking and following on their treatments are very important parts of our system.
Yes, Mike. And so, and you're talking about the fact that this is something that keeps the doctors and the patients connected with each other. It's an extremely important concept, isn't it?
It is, and I think that's essential, especially in today's world. We even need to talk about COVID. It's just always been important for that communication to be there, to be timely, and to not be a drain on either the patient's life or the doctor's time, their chair time, their office time. So our platform, from the provider standpoint, is there to help them with that and kind of keep them from redlining, keep their staff from being overworked, and provide more opportunities for new patients because of the time it frees up with their existing patients.
Yes, I would like you to explain that word redlining in just a minute. And also the fact that you have a HIPAA compliant program platform makes it extremely important because we have to be aware of that as healthcare providers.
Yeah, and that's essential. And a lot of people underestimate that and don't pay attention to it, which is risky. One of those things that it's just like insurance. When something goes wrong, if you're not HIPAA compliant, you have tremendous liability, and there's going to be a tremendous drain on your resources to accommodate those issues. We have it; it's just integrated into our system. So all aspects of it, all communications, whether in whatever form they are, they're covered, they're encrypted. They're encrypted at rest or encrypted in live. So that was a standard that we based the platform on when we built it to begin with. As for the redlining, this is what we've heard from practices that they were in. I'll take, for instance, an orthodontic practice. They were redlining. They were overworked. Their staff was stressed out. They weren't able to handle their patient load, and so they were faced with the decision: do we bring in an associate? Now, in this one case, they had an associate coming in a year or two because the owner's son was getting out of his internship and was going to join the practice. And so he said, I really don't want to bring in that associate. for a short period of time. They started using our platform. They dropped their staff hours from 38 hours a week over 2 years down to 30 hours a week. So now, they're kind of half days on Thursdays and off on Fridays. They increased their case acceptance, their treatment acceptance by over 20%. So because they had the platform in place that could help, and needless to say, because of the chair time savings, which is the easiest calculation to do, their profit just skyrocketed. I mean, they were able to double their profits over that period of time just using our platform. So it has a tremendous impact, and it helps the practice to not be stressed, but be more responsive to the patients. Like with in the case of aligners, doctors typically see them every 6 weeks.
Right.
But with our platform, you can see them every 26 weeks or at the beginning and at the end. But using our platform, you're seeing them every time they change their aligners. You're communicating with them whenever they need it. The net effect is way less time for this practice. There's much more patient adoption, engagement, and satisfaction, and you prevent problems from going on. You're taking care of mid-course corrections. You're reducing the number of refinements. In the case of chiropractors, you're preventing an injury from becoming a greater problem and traveling to another part of the body. So there's so many things that we can do with it, and I got into a little bit of a diatribe here.
Oh, that's okay. So redlining means that the practice is just filled to the gills, can't get anybody else in. People are burned out. They're actually overbooked, and now they need some relief. And yet you're saying that you can relieve that and increase production at the same time and produce better care for the patient by just having this, what you call real estate on their phone.
Right, and that real estate on the phone is a very good way to put it, because when you have an app on a patient's phone, that is active, it's active in the background, and it's your conduit to be able to notify them, give them alerts, remain in contact with them, communicate, share information, just consequential, non-consequential information, just to keep the relationship going. But as back to the redlining, you free up chair time and you relieve the stress, but you also have more time for new patients and more patients. So even though that example I gave of that one orthodontist practice, they increased their patients, the number of patients over that period of time, even though their staff hours went down. So you saw a top line increase in revenue, you saw a bottom line increase in profitability by using the platform.
That's exactly right. And so this particular application on the phone allows you to communicate with patients just like we're doing now through a portal on their phone, that you can have an administrative app on your phone, so you can see all the patient's activities, and they're color coded, so you know who's in compliance with your home instructions and who is not in compliance at a glance. Is that correct?
Right. And that's two good points. We have a dashboard, and we have patents. We have some patents approved. We have some other patents pending, and our dashboard gives you a quick visual representation of how your patients are doing. So we have what we call our treatment MPH, that is a composite index that scores a patient on how compliant they are, their feedback, their survey information that they provide, so that it gives you a score from 0 to 100, maps that from red to green. So when you look at the dashboard, green patients are doing really well. As it starts going towards red, they need attention. And on that dashboard, you can further filter it by what we have called care groups, so that you could have a back pain care group, you could have a sports injury care, and be able to just look at that group. So this gives you, so you're able to be responsive and see that right there. The patient sees that same data, so they've got the same data that you do, so they know how they're doing, which is motivating. Motivating them.
So weight
But
loss programs could be monitored, exercise programs can be monitored, any kind of thing you want to monitor on the patient. And they have just a little scroll bar on their phone that they report to you every day what they did and what they didn't do, and you have that immediately at your fingertips. Is that correct?
that's correct, and that's adjustable. That's the one thing. When we bring a practice on, it's a very short onboarding. It's an hour, hour and a half to get them up and started because we have a bunch of treatment templates that are standardized, and I know you've worked with us on yours. That becomes a single click to get a patient up and going.
Yeah.
But those are all configurable, and you can, as a practice or as a group, you can tweak those to say you don't want them to report every day, you don't want them to report every other day, or you want to ask this question today and another question tomorrow. And that kind of information is there, and it all happens automatically. And on the communication side, when we have a patient, it's a very powerful system in that you have assigned staff for that patient. And all the assigned staff can communicate with the patient, and they see what communications come from the patient. We have this patient message. We also have a clinical message thread where the staff can communicate between themselves about the patient, and we can even bring in outside associates, a surgeon, maybe viewing in on this particular patient and be able to offer information and help on that for that patient. So you have the capability of communicating, and now by the way, we operate as a mobile app for patients because that's the most effective way, especially when it comes to virtual visits and looking at pain and location and or whatever. But for the providers, we have a web app that'll run on any computer in any web browser. But we also have a mobile app that is very powerful. We call it Essentials because it doesn't have everything the web app in it because you just can't get that on a phone. But you get all the important, you get the dashboard on the phone, you get all the communications on the phone. You're able to edit and monitor their treatments on the phone. So the doctor will get a notification when there's a message.
Yes.
All the staff will get that notification.
Yes, Mike. And I'm using that app for my coaching clients to coach them to be doing what they're doing, should be doing to make their successful practices go. Now, the other thing I wanted you to talk about is the concierge program, because I've introduced this to Indian Health, and I think you guys are beginning to see that this is the icing on the cake. I want all my clients to go on the concierge program that you guys offer, and the concierge program allows you to bill the patient on behalf of the doctor at $7 a month or $10 a month, whatever it is, for that patient to be in the monitoring program with you. I suggest that all of my clients put every patient on the concierge program so that you guys can just write a check at the end of each month to the doctor for the patient's compliance and porting and telehealth monitoring.
Right, and that's a very powerful piece that we have. We can have any kind of a program that's involved in our concierge care. It's done in a way that there's no charges to Apple or Google or anything like that. So and the payment goes directly. So when that person makes a payment, it goes directly into the doctor's account.
Oh,
so
okay.
There's no flow through.
We
manage the costs of credit card costs and transaction fees, but the net payment goes straight to the doctor.
So, Mike, let's get specific about the reactivation program. How would this be used in reactivation of inactive patients, do you think?
Well, this ties in with the real estate on the phone. So when the app is on the phone and you've got one of your patients and you put them on the app, could have been months ago. That app is still there. Notifications and alerts are still active. So you have the ability to reach out selectively to any patient, all your patients, a group of patients with information. You say like, there's a new footwear from Nike, and here's a link so that you can see it. If you want to talk about it and see how that might assist with your running skills, reach out to us, send us a message. You can sit there and you can schedule outreach so that you can say for example, what a dentist would do on a retainer. They set out either a 3-month or a 6-month follow-up, and the patient will get a notification. We'd like to see a picture of, you take your pictures of your mouth so we can see how the retainer's doing. That can be scheduled. You can reach out and say, it's time for you to reschedule an appointment. We can do plugins for, we have a plugin for a scheduler that they can immediately pick a time and schedule an appointment to come back in for their oral hygiene or their just fitness check if they're working with the chiropractor.
Right. So, Mike, if a chiropractor had all of his patients on this app, even a free application for that patient, and then those who want to be monitored regularly could go on the concierge program, then you're saying that this app could be applied to every patient and allow you to reactivate them when they become inactive, or at least stay in touch with them. Is that correct?
That's correct. And we consider In-Hand Health a care platform. So the goal here is to help the doctors with their care of the patients, help the patients to get better care from their doctors.
All right. And I see it as a possible way for us to also implement and I'm working on right now, a remote monitoring program for anything that is reimbursable and accepted by Medicare or Medicaid, or even insurance plans, because right now we're doing an application for sleep medicine that may make it possible for us to get reimbursed with insurance programs through this app. So I'm really excited about what we're going to be doing.
And we worked, we worked with our physical therapy clients to make sure that we had all the reporting available they needed to submit claims for virtual visits and ongoing reporting.
Right. Very good. Well, Mike, this has been really enlightening. I think that, and I'm excited about the program. I've been using it now for about a month, maybe 2, and all the people that are going into the screen diagnosis and referral program are now using this app and reporting to me, and then they're using it for their patients so that their patients can be monitored for better health. So I can't see it anything other than a win-win for this situation. So thank you very much for that.
And I agree. And you've done a wonderful job. I have to commend you. Your approach took our platform to a new level, a tiered level of how you can assist with providers, and at the same time, the providers use the platform to work with their patients. So it covers 3 aspects and not just 2. And that's pretty exciting.
Yeah, in the way that I'm monitoring my clients is the way they'll monitor their patients.
Right.
I've turned my clients into patients for my app, and then with my admin console, I can watch what they're doing, and then with the same principle, they can use their app to monitor their patients. So it's a 2-tiered program. Thank you. I appreciate it.
Pretty ingenious on your part, sir.
Thank you so much. Well, thank you, Mike. I appreciate this. If they want to know more about In-Hand Health, contact me at sleepbalanceacademy.com and contact me, and I'll help you get in touch with In-Hand Health to work with your practice. Thank you so much.
Super. Thank you, doctor. Have a great